Today on Keynote.
You have to make sure that you're not saying yes to everything, that you're really trying to make sure that you're doing the right thing for St. Jude, not just today, but a year from now, 5 years from now, 10 years from now.
My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, where we are dedicated to transforming healthcare one connection at a time. Our Keynote show is designed to share conference level value with you every week. Now, let's jump right into the episode. All right, here we are for a Keynote episode, and today we're joined by Keith Perry, St. Jude Children's Research Hospital CIO. Keith, welcome to the show.
Thanks, Bill. It's great to be here.
Yeah, I'm looking forward to the conversation. St. Jude's is fairly well known. There's been ads since I was a kid. There's been ads on TV, but I'd love for you to give us just the overview of where St. Jude's is at and the type of services you offer to not only the community, but to the world, really.
Yeah, the vast majority of us have grown up with those commercials and hearing the story of St. Jude and not our patients not having to pay for their care and treatment. And so I remember as a child, what we say is our focus is more than just our commercials. So our commercials, because of our funding, is on the generosity of the American public. Our aim is to eradicate catastrophic pediatric disease, and that's primarily cancer and other blood disorders. And that's with not only the care of the patient in front of us, but also how do we discover new knowledge that can help in that fight. So we've got both the clinical side, but also a very large research and scientific discovery endeavor as well. So it's a blessing and an honor to serve the mission here.
It's pretty amazing. I see the cranes behind your window there. For the people who might be listening to this, they don't see what I'm seeing, but it looks like you guys have a lot of work going on down there.
Yeah, we've got a lot of construction on campus, which makes it somewhat of a logistical challenge because we are a closed campus, but we're in the middle of constructing two 15-story towers. One's for a clinical office building and one's a clinical outpatient building.
Those building projects are really interesting for CIOs. It's exciting because it's just an exciting thing to do, is to be able to do something greenfield and whatnot. But it's really challenging too, because you're like, all right, how are we going to do this? We want to future-proof it, but you have to build with the technology you have today, but plan for it's a really interesting challenge for a CIO, an exciting challenge, but challenge nonetheless. Talk a little bit about what it's like to be a part of those construction projects.
That concept that you just had, that's a microcosm of what a CIO's role is, or what an IT function is, right? Is you're taking technology that we know today, trying to future-proof it for tomorrow, but we know that's not going to be good enough. So you've got to find a way to introduce new things in the future. So it has been a fun endeavor. We've spent an inordinate amount of time visioning what that exam room of the future is going to look like with what we know today. And how do we design that in such a way that it's already day one, but also is ready to introduce some of that future that we see happening with pediatric care.
Let's talk a little bit about that future as we're looking at the changing care venues and how we deliver care. What are some things that are maybe different as you're looking forward than what we have today in the exam room?
You know, we're all talking about having that ambient listening ability. So somebody is having technology that's able to help improve the care coordination and the delivery and just the operational aspects of listening and interpreting and deciphering and developing work list as a result of a conversation that you're having. I think that's one of the things that I would say the vast majority of healthcare organizations are thinking about and planning, and in some cases already implementing. And we're no different than them as well. And then just the whole logistics on what does cancer care in the pediatric space going to look like in the future. And we've done models on how does that flow today so that we've optimized, but we also know that's going to be evolving too as we introduce different types of tests and what that test mean. And so it's been a really fun endeavor thinking through that, what tomorrow looks like.
Pediatrics is interesting to me because I realize a lot of care is family-based, but pediatrics is absolutely family-based. And so there's a connection, keeping them connected with the care providers, it just in the entire process of that. Talk about what you're doing in terms of connecting the care team to the family and how that communication's evolving over time.
Yeah, I'll give you a great example. Let me first back up and talk a little bit more about St. Jude and how we think about it. When we say no patient or their family pays for care and the delivery of care, we really mean that. And so we'll fly them to Memphis. We'll put them up in our housing. You see some of the housing facilities in the background. Their care is paid for, their food and lodging, education, and we try to meet those needs as well. All of that is provided. And so you think about that in the family unit too. And housing is not just a single bedroom. These are 2 and 3 bedroom units where the family is together. We want to keep them together. And so one of the challenges that we had to work through is look, okay, if we're with that, why are we making our families come across campus just for a blood draw in the morning before their round of tests and round of appointments in the afternoon? And so we're trying to push that challenge to housing so they really just come down in their pajamas and they're able to get that blood draw. And so that there's technical challenges that are associated with doing that we've had to work through. But that's been an exciting opportunity to rethink and reimagine. Can we constantly improve the delivery of care to our patients?
How much of the care is, no, clearly you have some care that's delivered right there on the campus, and that's fascinating in and of itself. But then how much of the communication and the connection is done remotely, where they're back at home and your physicians are interacting with them there?
Yeah, we've got, I don't know the breakdown. So we've got affiliates throughout the country that are really connected to us and delivering the type of care that you would receive here on the St. Jude campus. So that's one aspect. But then when they're off therapy and they're back home, we're still in contact with them for, in some cases, for the duration of their life. It's not uncommon for us to bring back patients that were here as children and we're doing follow-up work on them because we're wanting to understand what's the long-term effect that that treatment had so that we can constantly improve that for the children that we're treating today. Once a St. Jude child, they're always a St. Jude. So they're always going to be part of the family.
Always connected. You talked about the affiliates. Do you rely mostly on Epic's interoperability to transfer?
Now we do. Now we do. But before, that was a big challenge. And it's a challenge for the industry, but it was a big challenge for us.
I remember that doctors would say to me, hey, these patients are showing up with these binders, and they're, especially the really complex cases, like here's these binders, and then we'd have to get them into the medical record. I assume that's from days gone by. We're not looking at that kind of situation much anymore.
Yeah, with our transition to Epic, it just works, right? So it's been great. I was just looking at the data the other day, and we share patient data with all 50 states, and it's not a huge burden for the IT team, which has been fantastic.
When that changes, does that allow that team, that integration team, to look at other challenges, like maybe integrating other devices, or where do you focus them next? There's so many things you do with data, especially at a research hospital.
Yeah, I would say that part of the transition and evolution of an IT organization too, right? So it's once you're able to put in place something that reduces the complexity of the technical stack and the technical debt that you have, it allows your team to think differently. So our integration team is, how do we optimize the integrations that we have? How do we bring on instruments? The evolution of instruments continues to grow, especially in the research and science space. And how do we think about that and sharing data across those paradigms and domains? And so it allows us to think differently about the problem when you reduce the complexity of the technical debt that you've been saddled with.
I'm curious if that's still a challenge. Are we seeing, let's leave tech debt out of this for a minute and just talk about complexity. Is the environment still getting more and more complex every day, or is it getting less complex with the platforms that we're heading towards?
That's a great question. I'm shaking my head, yes. But at the same time, when I think back to, and again, been in this for a while, it's pretty simple to set up an application. You just go get a server. So it's very simple from a technical infrastructure perspective.
Isn't it easier now? I just drop my credit card and I have another application.
You can, yes, there is. But there's all this downstream complexity that you have with managing cloud environments and which cloud environment, and then the whole information security umbrella. How do you protect that data and those digital assets? And then how do you make sure that's up and operational so that you're supporting a clinical research and a pure scientific environment? It's more complex in one way, but it's less complex in terms of hopefully standing up new functionality, like you mentioned, in terms of just throw a credit card at it. And
Yeah, the platforms, it's interesting. The cloud platforms are interesting to me. It creates a complexity because they're almost doing updates without you approving them in some cases. There's some systems, hey, they just every quarter they just do an update on the system and then you log in that morning and it's updated. And to a certain extent, that's easier for us because we have refresh cycles we used to have to do on every system. That was very challenging. But on the flip side, we have a lot of workflows that are highly dependent and highly, it could be sensitive to those changes.
so you're correct. On one hand, that's fantastic that they're patching and keeping updated and introducing new functionality. But yeah, it sometimes has the potential to break. But you have to go through those accelerated validation cycles to just ensure that everything's working.
Yeah, testing becomes more important. How are you thinking about AI? How's that for an open-ended question?
It's interesting because, again, we're a research organization. So when generative AI hit, when we're talking about that as a leadership team, the response is we've been doing AI for a while now in the broad term, especially in our scientific side and neural networks on imaging analytics and some of the stuff at the cellular level. It's really fascinating to watch. The generative stuff is really exploded and exciting. So it's exploded in terms of allowing us, like everybody else, to rethink how can we use this new tool that's been given to us in a thoughtful manner that really helps advance our mission, and how can we put it to use. And so it's been really fun to watch. And so we've got use cases stood up all over the institution, from administrative to clinical to our scientific and research side.
How do you keep it from taking a life of its own and creating its own complexity out there? I'm using 3 or 4 different generative AI tools. Researchers tend to want that kind of flexibility to bring in the tool they need to do the research. How do you give them flexibility, but still keep some semblance of control? Obviously, we need security and other things. We need to keep that control around the systems.
I think that's part of what my role as the chief information officer is, helping the organization to be able to look through the window of technology and see the possibilities, but also understand there's other windows on risk mediation and just understanding what's possible, but also what's the risk associated with it. And so with the generative AI, we recognize early on, hey, this is something that has a lot of potential and a lot of risk associated with it. And so we got a group together. We've been meeting monthly for the last year and a half, almost 2 years now, to work through that. We've come up with a policy that kind of gives those researchers and the scientific community guardrails on how should we be doing it in a clinical setting versus how should we be doing it in a research setting, which has a little bit more flexibility. But then understanding who's ultimately the owner of that. So like you, I use some of these tools too. I also recognize that if I'm advancing something, I'm passing that off as my voice and that I'm taking responsibility for it, as opposed to saying somebody else, a technical tool did this. So
Yeah.
working through that and then helping the organization see the possibilities, the opportunity that's in front of us.
Yeah, it was interesting earlier this year. We had a lot of this discussion, and I think UCSD, Stanford, and some others decided that when they implemented the generative tools around creating the note, potentially creating a note back, that they identified it. They literally said that this note was generated with the help of an AI tool, but reviewed by your physician, essentially is what it said.
Yes.
And I don't think we got a lot of backlash for that. People were like, yeah, no, if the tool helps you to do your job, great. Yeah, so that's really interesting. How did you give me an idea of how you got to this role? So what was your path to get to this, to the CIO at St. Jude's?
I didn't start off thinking I wanted to be a CIO, right? So I got into technology because I didn't like talking to people, right? And so I was an introvert that really loved computers. And so went to school, got my undergrad degree in computer science, and then got my first job, programming job out of college in oil and gas. Decided I needed to go continue my education and went back and got my MBA at night, really focused on not technical stuff. So more accounting and finance, just because that was fascinating to me. I don't know why. And then found an opportunity in Nashville with HCA, and that was my first foray into healthcare. And I fell in love with the opportunity to be somebody that's focused on technology and how can we give back to and help the healthcare industry help fight, save lives. And that journey led me to MD Anderson, where focused on adult cancer and pediatric cancer. And I just found out I had an affinity to really make it my life's work to serve that segment of catastrophic disease, primarily because I never met my father's mother. She passed away when my dad was young from cancer. And I lost my other grandmother when I was 9 years old. So I really grew up with very little. I only had a grandmother for a short period of time. Both passed away from cancer. And so I hate this disease. And then working at MD Anderson, I've always been in healthcare IT, or always been healthcare IT most of that time. A recruiter called me and said, "Hey, St. Jude's looking for a CIO. You want to talk to him?" I was like, how can you not say yes to that opportunity? And so flew up here to Memphis, and I'll never forget it that I walked into the doors, and if you ever come here, there's a line of red wagons, and that somebody took the time to line up, and they're all perfect, just waiting for their families for the day. And somebody took the attention to detail to clean those red wagons and to line them up perfectly. I was like, if there's a place that has that much attention to detail for these families, that's where I want to be. And luckily, we connected on where I was going and what they were looking for. And I've been, again, like I said, I've been blessed to serve this organization for 9.5 years now.
I appreciate the fact that it's driven by life experiences and it's a passion to really address cancer as a disease. And the reason I asked that question is when I was a CIO, I'd get that question all the time. Hey, what do I have to do to become a CIO? I want your job. Someday I want to do what you do. And there's no clear path. It's not like there's some things that are pretty clear. You should know some stuff about technology. I like the fact that you got your MBA. One of the things I would tell people who are real strong technologists is branch out into the business, like understand, make yourself valuable in that room when they're talking about the business. Expand your clinical knowledge. You're not going to go back to become a doctor or clinician per se. Expand that side of it, because when you do, you just increase your value in those rooms more and more until people go, yeah, we want you in that room because you add value to the conversation. Obviously, you bring your expertise of technology, but you also have those other things that you're bringing to the table.
Yeah, I tell people I talk to that ask me that question. I said, first of all, they would not have even talked to me without an MBA or a master's degree. Right? Yeah. That's the base level. But then on top of that, I took that opportunity once I decided healthcare was my career journey. I had no idea what these clinicians were saying in these rooms, right? And so you're listening to these words. I was like, that's English. I understand that, but I have no idea what that is. And so I went back and took coding classes and medical terminology classes at night just so that I could understand what they were saying. And you try to find a way to immerse yourself. The other thing I tell people is don't be afraid to move around. I've been honored with mentors that have pushed me into managing. So before I got here, I'd managed an electronic medical records team. I managed networking, the data center, the networking teams, the telecom, the client service. I've done basically every job in IT and healthcare in an academic medical center before. So that prepares you for conversations with your peers and leaders because you know what systems they need and you know what the challenges are that they're trying to work through. And that just further prepares you for growth in your career journey.
It's always been fascinating to me as a CIO. They'll say, what's a normal day for a healthcare CIO look like? And I'm like, I just throw up my hands. Look, here's the thing I can tell you. It starts early and a fair number of times it ends late. But because you have a meeting here or a meeting there or whatever, you're meeting with a vendor or whatever. Outside of that, your day can start normal. Hey, you're just looking at email, you're preparing a presentation, then there could be an outage, there could be some strategic project. But even if it's a normal day, you could start talking about research. And then the next meeting, you're talking about food service. The next meeting, you're talking about connecting with a community or connecting with Minnesota. The conversations are so vast for a healthcare CIO. I'm not sure what a normal day looks like.
I had a boss at HCA in the 90s, and he's a fantastic mentor. I was just moving into that management role. And he said, you got to prioritize your day in 15-minute chunks. So you're dealing with a problem in 15-minute chunks and you have to move on. And every once in a while, you're blessed with to be able to spend an hour on something. But like you said, Bill, you're jumping between multiple different things that are vastly different from each other.
A lot of context switching.
Yeah.
And some of the meetings you walk in and you go, what was this meeting about again? Okay. Yes. And you're going through the file in your mind and you're going, all right, yeah. All right. No, I talked to my team about this. It's really interesting. Let me switch gears a little bit on you. And that is, we're launching a sales certification for the 229 project. And one of the things we're hoping is that we can elevate the relationship between the sales professionals and the healthcare professionals by educating them a little bit on what you go through, how you make decisions, how healthcare works, the difference between a pediatric hospital and a pediatric research hospital and an academic medical center and whatnot. And so that's what we're trying to do. And I've been asking CIOs these kinds of questions recently, like what makes somebody a good partner for you? What makes a sales professional who comes in a good partner for you to work with?
I'll give you a roundabout answer. What I tell people is that, especially the new partners or new vendors that are coming in and want a relationship, is okay, first thing we're going to do is we're going to tour. You're going to come here and you're going to tour, and then we're going to talk and we'll negotiate second, because I want them to understand what we're trying to do and what we're trying to accomplish. And I want them to see it firsthand. I want them to walk the hallways and see the kids and see the families. And then I'm going to talk to them about, look, the families that are here, we're a closed campus, are here because their child has a catastrophic disease. Put yourself in their shoes. Now let's talk about technology. And now let's talk about what problem we're trying to solve. And so to answer your question, it starts with that. They have to have an understanding of who you are, what you're trying to accomplish. But then it goes down a step, is I want them to advocate internally within their teams on our behalf on really what problems that we're trying to solve, and coming forward with ideas and that help us and not distract us. So like, for example, I can't tell you how many times I've had people reach out from the vendor community and they want to talk about revenue cycle optimization, which I understand that's a huge issue within the healthcare industry. It's like,
not for you.
First of all, let me go back to, do you know why we're here? And yeah, we have a revenue cycle team and they're fantastic. That's not our driver, is catastrophic disease. And how do we end this? And so it starts with understanding the mission. It ends with them kind of coming back and forming a partnership that really help them bring the technology to us that we need to solve the problem.
Yeah, that's really interesting.
Probably going to get in trouble with some of my revenue cycle friends.
No, you're distinct. It's like going to the VA and saying, let's talk revenue cycle. It's different for the VA than it would be for another health system. Yeah. And it's a little different for you. You're not going to pass any of those costs on to the patient after it's been processed through the normal channels. I think I'm going to close with this question, and it's really about culture. I served in an organization that had a very strong system culture. It had a 150-year history and just a long legacy of commitment to the community and those kinds of things. But then I had IT, and obviously we wanted to be a part of that culture, but there was distinctives within IT. It wasn't just, this is what we are. We wanted to have a culture of innovation and those kinds of things. That's how I would describe our culture. I'm curious how you would describe the culture of St. Jude and the culture of the IT organization, and how are there distinctions in the IT culture, or is it just one culture is very focused?
We do these employee surveys once a year, and we ask people if they understand why we're here. And 98% of our respondents say they understand our mission. And that's something that you pick up on really quickly when you come to campus, and you'll see us go out of our way for a patient and their family. For example, we have food trucks that used to come on campus. They starting to now again, but long lines would be formed at lunchtime at these food trucks. But if a patient, I've been standing in those lines and you see a patient, their family, and come up, and they'd start to walk to the back of the line, and everybody's, nope, you're going to the front of the line. Your time is more valuable than my time. That just permeates the culture here. And so taking that to the IT organization, I would say that culture is there as well, in terms of how do we make sure that our technology is serving the mission of St. Jude. And that's the culture that everybody in IT feels, in terms of they'll go out of their way to make sure. Now, that kind of brings in some challenges. You have to make sure that you're not saying yes to everything, that you're really trying to make sure that you're doing the right thing for St. Jude, not just today, but a year from now, 5 years from now, 10 years from now. But that's just part of the culture here, is how can we help? It goes to our core values, is how can we work collaboratively to make others successful?
And I love that's such a great story to end on, because that culture of, hey, go to the front of the line for the food truck is you want that to permeate IT, right? We're here to serve. How can we make it work? Appreciate that culture. Keith, I want to thank you for taking the time to share with the community and share your experience and your wisdom. I really appreciate it.
Awesome. Hey, Bill, it's been a pleasure. I really appreciate the talk.
Thanks for listening to this week's keynote. If you found value, share it with a peer. It's a great chance to discuss and in some cases start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. Love it if you could do that. Thanks for listening. That's all for now.